the digital version of Restore 2 to enable the carer to have a secure and reliable mechanism for transferring all the data, the questions, the soft signs, the vital signs that are present in Restore 2 to a clinician in a safe and secure manner. And if any of those parameters are out of threshold, then an alert will be generated and the relevant clinician notified.
When we started with the paper format, obviously the care home would do the observations, and although they would impart some of that information to the receptionist who might hand it over with the details of the GP call, we didn't have that whole assessment available to us at that time. You were still dependent on phoning the care home, getting through, getting hold of the right member of staff with those delays, and then they would tell you all of the detail and you would make those decisions. With the digital and the Docabo, we now get that whole report coming through to us straight away. So it has really helped us respond more quickly when needed, but also I think give the right response.
With the Docabo system, we're able to complete the data online. That goes immediately to the local surgery. So you're effectively 24, 48 hours in advance. For staff, it gives them confidence to know they've done their very best for that person. We had a case here several months ago where we have a resident, it was an elderly lady who was suffering with COPD. It was quite late in the evening, whereas normally, the GP surgery will have left by 6 o'clock, 6:30. When we knew we needed some intervention, some sort of further medication for this lady, she was quite frail and quite poorly. We had a telephone call back within 5 minutes from one of the practice managers. The prescription went across to the local pharmacy digitally, electronically, and we had the medication before the end of day.
It made us confident, gave us the confidence, and supported the staff who work on the floor, how to escalate. The staff knew what needs to be done or what's best for the resident, how to react if they get unwell. So the resident's point of view, I think we as a care home managed to do the best for the resident, do the best quality care that we promise to the resident by using Restore 2.
Quite easy to roll out once the initial workload of getting everyone's new scores initially was over. So when we first started using the News 2 and Restore 2 at Littlebourne House, we used it for a select 16 high-risk patients, and so then that got us used to using it, and then slowly we integrated it into the whole home and all the residents. It's been really positive, so it's nice to have the ranges there in front of you so you know if you need to be concerned or not and to escalate if needed.
Working closely with the Academic Health Science Network and Kenton Medway CCG, and indeed the PCNs on the project delivery side, has been really successful. We've had regular meetings to gather requirements, track progress, and delivered joint training sessions, and indeed helped to provide an extended support network.
I think the benefits are huge, and we're really pleased that with the pilot we did with Littlebourne House, without a doubt it saves clinical time, but I do think it enhances the care to the resident, and that is the fundamental thing for me.